Hello, everyone. Today we will learn about the morphological structure of the stomach. The stomach is the largest part of the digestive tract. Food enters the stomach through the esophagus, mixes with gastric juice for preliminary digestion, and is gradually transported to the duodenum. 1. Position of the stomach. The position of the stomach varies significantly depending on body type, posture, and filling level. When the stomach is moderately full, most of it is located in the left hypochondriac region, and a small part is in the epigastric region. The positions of the cardia and pylorus of the stomach are relatively fixed. The cardia is located on the left side of the 11th thoracic vertebra, and the pylorus is approximately on the right side of the first lumbar vertebra. The greater curvature of the stomach is relatively low, and its lowest point is generally at the umbilical level. When the stomach is highly full, the inferior edge of the greater curvature can reach below the umbilicus, even lower than the level of the iliac crest. The highest point of the gastric fundus is lateral to the left midclavicular line, reaching the level of the 6th intercostal space. 2. Morphology of the stomach. The morphology of the stomach is affected by multiple factors such as posture, body type, age, gender, and filling status. When completely empty, the stomach is slightly tubular. When highly full, it can be balloon-shaped. The stomach has a TW-refice, two-margin, two-walled morphology. The entrance is the cardia, the exit is the pylorus, the upper margin is the lesser curvature of the stomach, the lower margin is the greater curvature of the stomach, and it has an anterior wall and a posterior wall. 3. Division of the stomach. The stomach is usually divided into 4 parts. The cardiac part near the cardia, with an indistinct boundary. The part above the cardia plane that bulges to the left and upward is the gastric fundus, clinically sometimes called the gastric fornix, which contains about 50 milliliters of air inhaled during swallowing. This air bubble can be seen on X-ray gastric films and is called the gastric bubble in radiology. The middle part from the gastric fundus down to the angular incisure is called the gastric body. The part between the gastric body and the pylorus is called the pyloric part. There is an indistinct shallow groove on the greater curvature side of the pyloric part, called the intermediate groove, which divides the pyloric part into the pyloric canal on the right and the pyloric antrum on the left. The pyloric antrum is usually located at the lowest part of the stomach. Gastric ulcers and gastric cancer mostly occur in the pyloric antrum near the lesser curvature of the stomach. The pyloric canal is about 2 to 3 centimeters long. The gastric antrum referred to clinically refers to the pyloric antrum or the pyloric part, including the pyloric antrum. 4. Adjacent structures of the stomach. The right part of the anterior wall of the stomach is adjacent to the left lobe and quadrate lobe of the liver. The left part is adjacent to the diaphragm and covered by the left costal arch. The middle part of the anterior wall of the stomach is located below the xiphoid process, directly attached to the anterior abdominal wall, and is the site for clinical gastric palpation. The posterior wall of the stomach is adjacent to the pancreas, transverse colon, upper part of the left kidney, and left adrenal gland. The gastric fundus is adjacent to the diaphragm and spleen. Through learning about the stomach, we have a general understanding of the composition of the digestive system. Next, we will learn about the lungs and the respiratory system. 1. Position of the lungs. The lungs are located in the thoracic cavity, above the diaphragm, and on both sides of the mediastinum. The 2 lungs have different shapes. The right lung is wide and short, and the left lung is narrow and long. 2. Morphology of the lungs. The lungs are conical in shape, consisting of 1 apex, 1 base. The lung apex is blunt and rounded, extending into the root of the neck through the superior opening of the thoracic cage, and protrudes upward above the clavicle at the junction of the medial 1/3 of the clavicle, reaching 2.5 centimeters. The lung base rests on the upper surface of the diaphragm. Compressed by the diaphragm, it shows a crescent-shaped depression. Costal surface, adjacent to the lateral, anterior, and posterior walls of the thoracic cage. Mediastinal surface, adjacent to the mediastinum, with an oval depression in the center called the hilum of the lung. Diaphragmatic surface, the lung base, adjacent to the diaphragm. The anterior border is the transition between the costal surface and mediastinal surface anteriorly, with a sharp angle. The lower part of the anterior border of the left lung has a cardiac notch, below which there is a protrusion called the lingula of left lung. The posterior border is the transition between the costal surface and mediastinal surface posteriorly, located in the pulmonary grooves on both sides of the spine. The inferior border is the transition between the diaphragmatic surface, costal surface, and mediastinal surface. Its position changes significantly with respiratory movements. 3. Lobation of the lungs. The lungs are divided into lobes by interlobar fissures. The left lung has an oblique fissure that runs obliquely from posterior-superior to antero-inferior, dividing the left lung into upper and lower lobes. The right lung has an oblique fissure and a horizontal fissure, which divide the right lung into upper, middle, and lower lobes. The surface of the lungs has impressions or grooves formed by adjacent organs. For example, both lungs have a cardiac impression antero-inferior to the hilum. The right lung has an esophageal impression posterior to the hilum and an azygous vein groove above it. The left lung is adjacent to the aortic arch above the hilum and has the thoracic aorta posterior to it. Through our learning about the lungs, we will learn about the kidneys in the next class. Thank you.